So flu or influenza is a common seasonal infection. It causes epidemics every year throughout the world. It's a viral infection and people will often be sick for up to a week. People get fever, body aches, cough, and may end up hospitalised, particularly if they've got underlying conditions. The common cold will generally cause a runny nose, sinus congestion, sometimes fever in the first 24-48 hours. But generally, people don't feel so unwell that they're in bed. They don't generally get body aches, and as a general rule, it'd be rare to be hospitalised due to a common cold. So there are a different group of viruses that cause colds. Both are highly contagious, so spread from person to person. And if someone has a cold or flu, it's best to use hand hygiene, hand washing to prevent spread. People believe that having the flu vaccine can occasionally cause the flu, which it cannot because it's not a live vaccine, it's an inactivated virus. So you may get minor reaction to the flu vaccine, and these are usually a sign that your immune system has been activated and usually a good sign that you're well protected, in fact. Other common myths are that the transmission of cold and flu is related to being coughed or sneezed upon. It's often hand contact that's actually more important, so the virus particles stay on surfaces and on our hands. Vaccine technology now in the 21st century is better than it's ever been. The vaccine we have for flu is very safe and it's quite effective. It reduces transmission within families, keeps people well and at work and at school. And for those who are vulnerable in the population, let's say elderly people, the main advantage is to protect that population. So therefore children and adults don't pass flu on to their elderly or frail relatives. And for those people who've got underlying medical conditions, it's strongly recommended that they're immunised against flu. The vaccination is also recommended in pregnancy because in pregnancy the complications of flu can be quite serious. So for healthcare workers, we're aiming for at least 80% of that population to be immunised, and we aim to do that so that we have an effective and preventative program and a healthy workforce, and it protects our patients, it protects our families and keeps us well in addition.